Watch it if your blood pressure is screaming at you.
You may never get high blood pressure after watching this video.
Here is what high blood pressure tries to tell you. In this video, we'll survey the high blood pressure subject matter with Dr. Berg. Imagine a bustling city, its streets teeming with life, its arteries pulsating with energy. But hidden within the vibrant metropolis, a silent pressure builds, a force threatening to disrupt the flow of life itself. This is high blood pressure, a condition that if left unchecked can weaken the very foundations of the city, leading to devastating consequences. Our bodies, like bustling cities, require a delicate balance of pressure to thrive. But when the pressures become too great, it can damage the intricate network of arteries and veins, weakening the very structures that sustain us. This story is about the quest to restore balance, to find a cure for the silent pressure that threatens to disrupt the rhythm of life. It's about the journey to reclaim the health and vitality that high blood pressure can steal away. It's about empowering individuals to take control of their health and to discover the path to a life lived in harmony with their bodies.
The most important thing to know about blood pressure is that it is a symptom. It's not a root cause.
High blood pressure, often considered a disease in itself, is actually more accurately understood as a symptom, a warning sign that something else is amiss within the body. It's like a red flag, signaling that there might be a deeper issue at play. Imagine a river flowing steadily through its banks. The force of the water, its pressure, is crucial for its movement and vitality. But if the riverbed becomes narrow or clogged, the water pressure increases, putting strain on the banks and potentially causing damage. Similarly, high blood pressure indicates that something is obstructing or interfering with the smooth flow of blood through the arteries. But if high blood pressure is not a root cause, what is the root cause?
It might be caused by, genetics or lifestyle.
Some individuals may have a genetic predisposition to high blood pressure. Unhealthy eating habits, lack of physical activity, excessive alcohol consumption, and stress can all contribute to high blood pressure. Underlying health conditions such as kidney disease, thyroid disorders, or sleep apnea can also contribute to high blood pressure. Furthermore, blood pressure naturally tends to increase with age. Now, people who are dealing with high blood pressure are divided into different groups. Many people try to control their blood pressure, and they do it. Some people are not even trying to control it, like they consume too much salt, and their blood pressure is controlled.
And when someone is put on hypertensive medication, 20% of the time, it doesn't work. Now, why wouldn't that work?
There is another group too. They are actually the group that is trying to cure the symptoms, not the root cause. Trying to cure high blood pressure solely as a symptom without addressing the root cause is like putting a band-aid on a gaping wound. It might provide temporary relief, but it won't heal the underlying issue, and the problem is likely to resurface, potentially even worse than before. Lowering blood pressure through medication or other symptom-focused treatments might provide temporary relief, but it doesn't address the root cause of the problem. The underlying condition continues to contribute to high blood pressure, potentially leading to a cycle of reliance on medication and a higher risk of complications. Treating high blood pressure as a symptom without addressing the root cause misses opportunities for prevention. Lifestyle changes such as adopting a healthy diet, exercising regularly, and managing stress can often effectively address the underlying cause of high blood pressure, reducing the need for medication and promoting overall health. Once the root cause is identified, a comprehensive plan can be developed to address it. This might involve lifestyle changes, medication, or managing underlying health conditions. No, I'm not going to give you more information to find the real problem with your body. Remember not to use any kind of medication without consulting your doctor.
Now let's get into the root causes, okay?
While the link between vitamin D deficiency and high blood pressure is still being investigated, research suggests a potential connection. Vitamin D plays a role in regulating the dilation and constriction of blood vessels. It helps relax the smooth muscle lining the arteries, promoting wider blood vessels and better blood flow. It's been linked to increased blood vessel stiffness, which can make it harder for the heart to pump blood and lead to higher blood pressure. Vitamin D deficiency can contribute to inflammation throughout the body, including in blood vessels. This inflammation can contribute to blood vessel stiffness and narrowing, leading to higher blood pressure. Vitamin D deficiency might lead to increased renin release. Renin is an enzyme that plays a role in the RAS, a complex system that regulates blood pressure. Increased renin levels can lead to increased production of angiotensin II, a potent vasoconstrictor that narrows blood vessels and raises blood pressure. Also, vitamin D is essential for calcium absorption. Calcium is important for healthy blood vessel function and maintaining blood pressure. Vitamin D deficiency can lead to calcium imbalances, potentially affecting blood vessel function and contributing to higher blood pressure. Low levels of vitamin D have been linked to insulin resistance, a condition where the body cells don't respond properly to insulin. Insulin resistance can contribute to high blood pressure, especially in individuals with metabolic syndrome. Now, a fact is that potassium-deficient people are more salt-sensitive too. But why? Like, how are they related? Potassium is the strong and steady one, responsible for keeping the city's walls, that's the cell membranes, strong and preventing them from collapsing. He also helps pump out excess sodium, who, while friendly, can get a bit too excited and cause chaos if left unchecked. Now imagine potassium starts to feel weak. He's not getting enough of his favorite foods like bananas, spinach, and potatoes. He's becoming potassium deficient. With potassium weakened, sodium takes over. He starts to build up inside the city walls, causing them to swell. This puts pressure on the walls, which are already weakened without enough potassium. This pressure is like high blood pressure in our bodies. It puts a strain on our blood vessels and heart. Because potassium is weaker, even a small amount of salt or sodium triggers a much bigger reaction. This is why people who are potassium deficient become salt sensitive. Their bodies are more easily overwhelmed by sodium, leading to higher blood pressure. To make things worse, the city's alarm system, called the renin-angiotensin system, or RAS, gets confused. It thinks the city is under attack and sends more sodium to defend it. This makes the situation even worse. The solution? We need to help potassium regain his strength. By eating potassium-rich foods and making sure we get enough, we can restore the balance, keep sodium in check, and prevent the city from becoming too sensitive to salt. Every individual needs 4,700 mg of potassium every day. Another fact is that the risk of high blood pressure goes up during winter.
The way the sun is angled at the earth, there's just not enough UV radiation to create enough vitamin D in our skin.
Even darker skin leads to higher blood pressure. People with dark skin are 2 times more at risk of high blood pressure.
On average, if you have dark skin, your risk for high blood pressure goes up by 2x. In your skin is a pigment, and it acts as a sunscreen. It blocks you of ultraviolet radiation, making it very difficult to make vitamin D. This is why the darker your skin, the more vitamin D you need to take, or the more sun exposure you need to have.
Now it comes to genetics.
There's a super high percentage of people that have a genetic problem with vitamin D that can't absorb vitamin D that well, and they need a lot more vitamin D.
So a genetic vitamin D absorption problem actually equals a genetic blood pressure problem. Imagine your body has a special key that unlocks the door to absorbing vitamin D. Some people are born with a broken key. Their genes make it harder for them to absorb vitamin D. Vitamin D is like a helpful friend that keeps your blood pressure in check. When you don't have enough, your blood vessels become stiffer and your body holds onto more salt, which can raise your blood pressure. So someone born with a broken key for vitamin D absorption might be more likely to have higher blood pressure, especially if they don't get enough vitamin D from sunlight or food. It's like a domino effect. A genetic problem with vitamin D absorption can lead to low vitamin D levels, which can then contribute to high blood pressure.
I mentioned that 95% of all blood pressure problems are essential, which means they're unknown cause. So it could be lifestyle, it could be genetic, they don't know. They just throw all these lifestyle things in a box and, we just don't know.
Even too much calcium in the arteries can cause high blood pressure.
And if you watch some of my other videos, I recommend taking vitamin K2 to direct the calcium into the bone or the teeth and out of the soft tissues. And there's actually even a test called the coronary artery calcification test, which is a really good indicator or a predictor of all-cause mortality. This is why people with cramps at night, or just leg cramps or feet cramps.
It's not just about how much calcium you consume, but also about how your body manages to utilize it. It's essential to maintain a balanced diet and consult a healthcare professional if you have concerns about your calcium intake and blood pressure. But why magnesium?
Really, they need more magnesium. Why? Magnesium prevents the calcium from building up in the tissues.
Also, people who tend to consume calcium supplements are more at risk of heart attack.
Because you're dumping all this calcium. I mean, some women are taking like 1,200 or 1,500 milligrams of calcium every single day.
The importance of magnesium is that it keeps calcium from getting too high.
And forming clots, that's right. Too much clotting, or a thrombosis they call it, could be coming from too much calcium.
Arrhythmias are because of too much calcium.
Magnesium is the antidote to preventing building up in the arteries, heart attacks, all sorts of things.
Now, we're going to introduce you to two medications to cure high blood pressure. The first one is calcium channel blockers.
Which, by the way, magnesium is a natural calcium channel blocker, but you can't patent it, so they use a medication. Then you also have something else called beta blockers.
And the second one is beta blockers.
Beta blockers block adrenaline. Okay, so if there's too much adrenaline in the body, your blood pressure will go up as well. And take a wild guess what a natural beta blocker is. Not just magnesium, but vitamin D. Both of these will naturally decrease adrenaline.
High blood pressure is often fueled by stress, which triggers the release of adrenaline, our body's fight or flight hormone. Adrenaline constricts blood vessels, making it harder for blood to flow smoothly and increasing pressure. By learning to manage stress through techniques like deep breathing, meditation, or yoga, we can lower adrenaline levels. This allows blood vessels to relax, easing pressure on the cardiovascular system and helping to naturally lower blood pressure. While not a cure-all, decreasing adrenaline is an important step in managing high blood pressure and promoting overall cardiovascular health. Now, here are 4 things I recommend to correct if you have had blood pressure.
Okay, vitamin D. I would take 10,000 IUs every single day, but if you're trying to correct high blood pressure, take 20,000 or even a little bit more. Now, if you have any thought in your mind that 20,000 IUs is toxic, being out in the sun for about 40 minutes will give you 20,000 IUs of vitamin D3. So 20,000 is not a toxic level. In fact, this is really like half of 1 milligram of vitamin D3. Magnesium, very underrated, but it's very important. I would recommend taking magnesium glycinate. You can get a good amount of magnesium from pumpkin seeds, sunflower seeds, spinach, other leafy greens, almonds, and even chocolate. Just make sure you don't have the chocolate with a lot of sugar. Magnesium allows vitamin D to work. These two go hand in hand. Then I recommend going on a low-carb diet because at the root of high blood pressure, metabolic syndrome, heart disease is too many carbs. And consuming too much sugar and starch depletes you of vitamin D, magnesium, and potassium. Okay, so you need to do that. Also, potassium is very, very important. You can get this from an electrolyte powder. I would recommend taking a high quality electrolyte powder that has about 1,000 milligrams of potassium with other electrolytes. But you can also get potassium from greens, but you have to consume a very large salad every single day. But the greens will also give you magnesium.
Now, as we talked about the relation between potassium and blood pressure, unfortunately, we have to say that only 2% of Americans get enough potassium. It means that 98% are deficient. While they are supposed to eat 7 to 10 cups of vegetables, they only consume 1.5 cups per day.
You can also get potassium from fish and some meats and nuts, and definitely avocados. That's a really good source.
That's while 90% of Americans are consuming too much sodium. This just creates a situation in which blood pressure gets higher and higher.
Potassium in general has a diuretic effect. It's going to get rid of fluid. Potassium causes the smooth muscle in your arteries to dilate. It's a vasodilator, thus lowering the blood pressure. Also, potassium keeps the vascular system from being stiff, because if your arteries are stiff, that alone can cause hypertension. Either increase the foods that are high in potassium, which I'll put some links down below on that.
Potassium also lowers the risk of getting a stroke, so it directly affects blood clots.
The consistency of blood. It reduces clotting, as in blood clots.
Potassium, the often overlooked mineral, plays a crucial role in regulating blood pressure, a vital factor in maintaining overall health and well-being. While high blood pressure can be influenced by many factors, including genetics and lifestyle choices, restoring potassium balance can be a significant step in managing and potentially even reversing this condition. By understanding the intricate dance between potassium and sodium within our bodies, we unlock the key to a more balanced and healthier cardiovascular system. As we've explored, potassium helps maintain a delicate equilibrium, keeping the city of our cells thriving. It pumps out excess sodium, ensuring a smooth flow of blood and preventing the buildup of pressure. This journey into the world of potassium highlights its importance in promoting a healthy lifestyle and preventing the silent threat of high blood pressure. By embracing potassium-rich foods, we empower our bodies to regulate blood pressure naturally and pave the way for a healthier future. Remember, potassium is not a magic bullet, but rather a vital component of a comprehensive approach to managing high blood pressure. By combining a potassium-rich diet with other healthy habits, such as regular exercise, stress management, and regular medical checkups, we can unlock the potential for a life free from the burdens of high blood pressure, a life lived with vitality and strength. After all these things, we really hope Dr. Berg's speech could have a positive effect and be comprehensive. Try to use the information practically in order to be healthier. Thanks for paying attention.